So I often get asked the difference between open and closed rhinoplasties. The most important thing is that the aim of the rhinoplasty surgery should be satisfied by the techniques chosen and discussed, obviously, with the patient so they understand what's going to happen. An open rhinoplasty allows exposure of the envelope of the nose, the framework of the nose, so that we can see every level of the framework of the nose open on the operating table. The visible scar is across the columella of the nose, and the rest of the scarring is inside the nostril. With a closed rhinoplasty, the scarring is inside the nostril and there's no visible scar across the columella. However, that scar across the columella is pretty nigh imperceptible. And so the benefits of open and closed rhinoplasty should not really be considered related to the scar or the visibility of the scar. They should be considered in the assessment of what is to be achieved by that rhinoplasty and whether or not the open technique or the closed technique is best going to achieve those aims. Broadly speaking, a closed rhinoplasty, because it does not elevate the soft tissue envelope of the nose, is considered to be less prone to swelling and deliver a faster endpoint result. However, the open rhinoplasty gives the surgeon a tremendous amount of flexibility in dealing with all levels of the nose and is often a better approach simply for that reason. I sometimes get asked whether a closed rhinoplasty is a safer procedure than an open rhinoplasty. And to be honest, it is not. The open rhinoplasty, if done properly, should be as safe as the closed rhinoplasty. Each has their potential risks and responsibilities, and it has the healing time and the long-term outcome. The aim of choice between an open rhinoplasty and a closed rhinoplasty should really be about the final result. Which technique is going to get me to where I want to be, and which technique is my surgeon going to be more comfortable with to get me to where I want to be? The factors determining the choice between open and closed rhinoplasty relate to what needs to be done technically within the nose. Most rhinoplasties involve some form of framework change, and that framework is made up of the bony part of the nose, the bony cartilaginous junction in the nose, and the tip structures, which are mostly cartilaginous. Each of those levels of the nose can be managed either by open or closed rhinoplasty, but it really depends how much manipulation of those tissues is required and whether or not the surgeon feels that they will be able to get the shape of those structures to where you need it to be in order to deliver the result. That is really what determines open and closed rhinoplasty. The level of complexity required to achieve the final result tends to shift most surgeons towards an open approach where the tissues can be very easily seen, manipulated, reshaped, and fixed on the table with a very visible result. The scarring of rhinoplasty should and will be, in most cases, one of the most forgiving types of scar in any appearance change surgery of the face. So the scar in open rhinoplasty runs across the columella, the midline strut of the nose, and different surgeons use different techniques to break up that scar to make it less obvious. And there are a variety of different little Z-plasties and V-plasties and so on to break up that scar. The rest of that scar lies internally around the perimeter of the nostril on the inside. Sometimes we will use external scars high up in the perimeter of the nose, in the tear trough, between the junction of the lower eyelid and the nose. And those scars heal beautifully. They're tiny pinprick scars, and they can be used to perform what's called an osteotomy, to just tease the bone into the right shape. So the external scars of open rhinoplasty are usually incredibly forgiving and are imperceptible to patients. I'm often asked how long will my recovery be from a rhinoplasty? Well, there's the immediate recovery, and that really is 14 days, a couple of weeks. If I operate on a Friday or a Saturday, I will ask my patients to take 3 weekends and 2 weeks off work. By the time they go back to work, the cast will be off the nose, there will be nasal shape change, but there will be visible swelling, and there might even be a little bit of bruising around the lower eyelid. With modern techniques of ultrasound or piezo rhinoplasty, even that bruising is minimal. The long-term recovery, so once we're back at work, the long-term recovery is really dependent in my scale of such things is at 2 weeks, somebody who knows us marginally well will not notice, but your close family and relatives will know that there's been some swelling in the nose. Usually by 6 weeks, perhaps 6 to 12 weeks, the even close family will not be able to tell that there has been any swelling in the nose or a procedure undertaken. And by 6 months to a year, the patient themselves, who's very intimate with their own nose, will have sensation back in the tip of the nose, and the framework definition will have emerged by about a year. So immediate recovery until the cast comes off and the swelling and bruising is still evident by 2 weeks to 3 weeks. Medium-term recovery is 3 months, and final definition of the recovered nose at 1 year.